I'm going to go ahead and start recording.
All right.
And you're good to go.
Okay, thanks. Well, good afternoon, everyone. Thanks for joining our webinar today. I'm Emily Beauregard, the Director of Kentucky Voices for Health, and I'm also a member of the ThriveKY Campaign. We're excited to have this webinar today. We have a special guest. So before we dive into the state and federal policy updates that we typically cover on these monthly calls, we're going to talk about COVID-19 testing and contact tracing. Both are absolutely critical to our ability to contain the pandemic by keeping infection rates down and saving lives until we have a vaccine. And the state really needs our help as advocates in making contact tracing successful. So I am really delighted to have Mark Carter here today. Mark is the advisor to the Kentucky Cabinet for Health and Family Services. He's leading the contact tracing program, and many of us know him from his days as CEO at Passport Health Plan. So Mark, welcome. Thank you very much for taking time to join our webinar today and talk about this. It's a very timely topic for advocates, and we have a big role to play. So we're looking forward to learning what we can do to help promote contact tracing and make it successful in the Commonwealth. And just before you begin, I'm going to do some really quick housekeeping. We've got a lot of folks on the webinar today. I know that people are still joining us. As you join, if you could make sure to mute yourself, that would be really helpful. We are recording this webinar, and we'll be sending out the slide deck and the recording as a follow-up, so you'll get that by email. And as Mark is presenting, you can use the chat box at the bottom of your screen to ask questions or to make comments, and then we can cover those at the end of his presentation before we dive into the policy updates. And I've already received some questions from you, so I'm going to start dropping those into the chat box once Mark starts talking. And so with that, I'm going to turn it over to you, Mark. You should be able to share your screen.
Okay. I think Becca's going to take care of that for me, Emily. Thanks for that introduction and for the opportunity to speak with this important group of advocates. You may have seen, or you all may have seen just recently, I think yesterday in some of the news media that some of the health department commissioners in the South and health department directors and epidemiologists think that contact tracing may be overwhelmed already in some of the southern states, Florida, Arizona, Texas in particular. Fortunately, we are not in that position right now in Kentucky, but it is the thing that I think gives us the most pause, is that contact tracing, to be successful, has to have the participation of the citizens of the Commonwealth. And, you know, I say that individuals have to put their individualism and their libertarianism aside and be members of a society. And so that'll be the thrust of some of my comments around contact tracing as we move into this. I have prepared about a 20-minute presentation that I'd like to walk through with you. It starts out with a brief video. It's a little less than 3 minutes long. Becca will play that, and then I have about 4 PowerPoint slides I'll walk you through, and I'll have a little ask of the group, which I know you're used to being asked, to help keep Kentuckians healthy. And I think you'll find this to be a challenge that you would be both well suited to take up and very effective in doing so. So Becca, can we roll the video?
Mark, I'm sorry. Give me just 1 second. I apologize.
Okay. While Becca's teeing that up, I usually start out my sessions. We've done these with a number of different constituencies, everything from county judges to school superintendents, mayors, chambers of commerce, our own staff within the Cabinet for Health and Family Services, for example, DCBS, the mental health community, and so forth. There's a lot of misinformation out around contact tracing and what it is and what it isn't. I think if anybody has a social media presence, you see some of the conspiracy theories that go around on Facebook and Twitter. You know, I really see this, and let me just finish that thought and we'll play the video. I really see this as a tool that the state is making available to individuals to help them protect their loved ones, their family members, you know, spouses, children, grandchildren, elderly parents. It's just a tool to help people keep them safe from the virus if you know you should contract it. So that's the way I look at it from a personal standpoint. If I contracted COVID, I sure wouldn't want to give it to anybody I loved, or really anybody for that matter. And so contact tracing is a way of helping me keep from doing that. So with that intro, let's see if we can get the video going.
To minimize the spread of COVID-19, public health workers need to know about exposures to make sure that all Kentuckians are safe and supported. We are using Kentucky's contact tracing and tracking system to help our disease investigators and contact tracers to gather the necessary information. Let us take the example of Sarah Smith, who is a disease investigator who starts her day by looking at a list of cases to act on. These cases are individuals who have tested positive for COVID-19. She picks up the case of Bobby Rim. Sarah reviews details about Bobby. She calls Bobby and begins the initial investigation. The system provides call scripts so disease investigators can be consistent with their messaging and make sure they do not miss any important information. Sarah confirms Bobby's symptoms, understands his needs around food, housing, and childcare, and finally, Sarah helps Bobby retrace his steps to document who he may have come in close contact with and which public settings he may have gone to while he was infectious. Among those people is Jan Johnson, who is Bobby's coworker. Once the call is complete, Bobby is directed to isolate since he is positive for COVID-19. To assist Bobby in recovery, the system automatically sends an email with helpful information. Sarah follows up with Bobby daily to make sure Bobby is okay and address his needs if they have changed. Once Bobby recovers or is no longer infectious, the case for Bobby Rim is closed. Once investigation is complete, the information is handed off to a contact tracer. Contact tracers are public health workers. Contact tracers such as Fred notify individuals who may have come in contact with Bobby, such as Jan Johnson, who works with Bobby. Fred calls Jan and notifies her of potential exposure to a COVID-19 patient. Fred is provided a call script to assist in gathering information he needs from Jan. Fred confirms demographic information, asks Jan if she has been having any symptoms, and gathers basic medical history. Based on Jan's responses, the system sends a tailored email to Jan with helpful information. Fred follows up with Jan daily to check on her symptoms and understand her evolving needs for support should she start noticing symptoms. After Jan's exposure timeline has expired and she hasn't encountered any symptoms, she gets an automated return to work email. To protect patients' confidentiality, case contacts will not be told the identity of the person who may have reported them. They will be told what they need to do to care for themselves, reduce the risk to others, and protect their communities from any further exposure. Contact tracing and tracking combines public participation and the power of technology to help public health officials and private healthcare providers contain the spread of COVID-19.
Okay, I know many of you have probably seen that at least once, but I think it does a good job of explaining how the system works. What I'd like to do now is step through just a few PowerPoint pages and give you some overall comments, and then I should have at least 10 minutes for questions at the end of the presentation. So Becca, if we could go to the first slide. I mean, the video does a good job of this, but the overview, or I guess the crux of the system is that the Department of Public Health, rather, has built a online tracking system really in a very rapid fashion. I came on board on May 14th, which now seems like a long time ago. And the system was just being rolled out in soft launch as I came on board. It's an incredibly fast launch for any enterprise. And, you know, when you consider the speed with which things get done in state government, it's pretty remarkable that the system was stood up this fast and deployed across 61 health departments across the Commonwealth. The objectives are pretty straightforward: contain the spread of COVID, tracing along with wearing masks and social distancing and all the basic things that this group knows well are really the key to keeping the spread of COVID under control here in the Commonwealth. And of course, you know, I have said this on multiple occasions, but I don't think that it's a binary choice that we have to choose between having at least a healthy economy and health and wellness and safety for our citizens. I don't think that that's a binary choice. I think that we can have it both ways, but to do that, we have to work together as both a public health sort of infrastructure and complex in the state, along with individuals doing what they need to do to help contain the spread. Next slide, Becca. There are two really key roles and responsibilities within contact tracing, and they are the role of disease investigator and contact tracer. Now, sometimes these roles are combined, but for the most part, they are separated. The disease investigator, as shown in the video, is usually a clinician, typically an RN, that works with the person that's received the diagnosis or the positive test. They'll talk to them about their lab results, what they need to do to isolate, and you know, they'll also make inquiries about any needs of daily living, like access to groceries or medicines, and then we'll discuss possible contacts with the patient. The contacts are then handed off to the contact tracer. I think the most important skill or talent that a contact tracer has to have is just really good interpersonal communication skills, because that person is going to interact with people from all walks of life with different levels of understanding of both the COVID virus and its spread, as well as the things that they would need to do to protect their family. So the tracer will review information that basically will make an assessment of the level of risk that contact has incurred. If it's a brief contact that maybe they talked to somebody in the Kroger parking lot, they were 6 feet apart, had their masks on, didn't last more than 5 minutes, that's a low risk encounter. You know, they'll probably just be recommended to watch for symptoms and watch their own health, and just to you know, sort of be careful in their interactions, but they won't be asked to quarantine. On the flip side, if you know, you rode in the car from Paducah to Lexington with someone that ultimately tested positive, and you know, you were locked in the car the whole time, not wearing a mask, that's a high risk exposure, and in that case, they're going to be asked to quarantine and so forth. There is a third position here that is not depicted, and that is of a social support connector. And the social support connector is usually somebody with a background in social work. That person would basically work with both the patient and the contact if they have daily needs while they're isolating or quarantining. So the typical things are access to groceries or to their medicine prescriptions, things like that. Next slide, please. You know, coming into this, I think I viewed it as viewed the role as sort of making sure that the technology was being managed, and that you know, we were going to be onboarding a lot of people, and that process be managed well. But I think what I quickly learned was, you know, the biggest challenge we had was communication, and communications really within state government, with the public, helping folks understand what contact tracing is. And so I think a lot of effort has been put into that over the last several weeks. You can see here some examples of some publications that we have available. All of these are on the KY COVID-19 website that's shown there in the lower or in the right-hand side of the slide. But we have public posters that try to educate about contact tracing and what you should do, the importance of answering the call when it comes in from the health department. Frequently asked questions document that is being updated constantly, that's available. Posters that are available to healthcare providers, health departments, and testing sites that can be posted about tracing, and then a lot of social media activity, which is, I think, is gratifying because the use of social media as a communication vehicle in the healthcare space and the government space has been limited. Well, I say that some of the politicians are pretty good at using Twitter, but to use Facebook and Twitter to communicate important messages like this has been something that state government in particular has been reluctant to embrace. And I think we've done this. So the next slide is essentially what amounts to the call to action. I think everyone we talk to wants to be helpful in this regard, because if we can keep the spread under control, we can keep the economy open, and we can continue to be a leader in this area across the nation. But these are the things that we need to have happen. We need audiences to be aware that they could be contacted by a public health worker to gather information around the virus. That they understand the importance of this process and the urgency to answer the call when it comes in, or to call back if they miss it, and then to follow the instructions that are provided. I think for this group, those first two things are important. The third one around distributing materials, I know you all can be a great channel for that, and I would hope that you'd be willing to help there. And then finally, just keeping an eye on the KY COVID-19 website, because it's updated daily. At a minimum, the case reports are put on there every day, but typically there's other collateral that's added to that website on a daily basis. And I know that the leadership does follow it, but to the extent the folks on the call would do that too, I think it would keep you very well informed. Again, I think our state motto of united we stand, divided we fall comes into play here. If we all work together, we can have it both ways. And, for me, it's about keeping the citizens of the Commonwealth healthy. And I believe if we can do that, we can keep the economy open and have it both ways. So with that, we'll stop there. And I can take some questions. You also should know that if there are questions that I can't get to, because I think I'm limited to 30 minutes here because of my schedule, that we will follow up and get you the answers. So with that, I guess, Emily, should I go to the chat?
Yeah, or if it would be easier, I can read the questions to you.
Okay, yeah, if you wouldn't mind.
Sure. So the first question is, what testing guidance should shelters and other frontline community service providers follow?
Well, right now, and I'll profess my ignorance a little bit on the testing. Dr. Stack and I have sort of broken this up. He's the testing guru and I'm the contact tracing guru, but I've absorbed enough of the testing, I can probably answer most of the questions. Right now, we are not advising asymptomatic people to get tested necessarily. So in the shelters, if you do have a person that's showing symptoms, you should encourage them to get tested. The test sites are published on the KY COVID website. And there is guidance on there that I don't know if it speaks directly to shelters or not, but I believe there's some guidance on the website around these types of community settings.
We can pull that guidance, and if it doesn't answer our question, would you recommend that we follow up with Dr. Stack or his assistant?
Yeah, or you can send a note to me, Emily, and I can make sure that it gets to the right spot and gets answered.
Okay, yeah, I can do that. There are a couple other questions related to testing, so I'll put those in an email to you, and we can just share those by email to everyone who's listening right now or registered for the call.
Yeah.
The fourth question there is about how contact tracers will work with employers specifically.
Yeah, the typical, well, I guess a couple of the concerns that I didn't talk about. One is privacy. It is a private process where the patient's identity isn't necessarily disclosed to the contact and so forth. However, if in the case where it's an employee in a work setting, we will be working with the employer to make sure that they know that they've had an employee that's tested positive, and that to the extent that they can isolate, that the contacts that employee might have had can be understood and then isolated to a particular area of the employer, so they don't have to shut down the entire operation. A good example of this are the chicken processing plants where we've had a number of outbreaks. So we have worked with the nurses and the management in those businesses to help them sort of isolate the outbreak of the virus so that they can continue to operate. Right. So we are trying to be cooperative with employers, and that's just part of the effort to try to keep the economy open.
Thanks. And then the next one is more for healthcare professionals, behavioral health professionals. And it's a little more involved, but how is contact tracing handled in situations where there are strict legal and ethical requirements for confidentiality? And for instance, between a mental health provider and patients, or a substance use disorder treatment setting. And then basically with the provider, if the provider is restricted from giving names, how do you do that work?
Well, in those cases, first of all, if there's a positive test, or diagnosis, there is a requirement that be reported to the local health department, the Department of Health. So, but the HIPAA, all the HIPAA rules, while there's been some relaxation in certain areas, they're still operative here. So we would not, if it was a patient of someone in a, 7 counties services, we wouldn't disclose that person's identity. We would, however, we would try to gather the contacts. We would not disclose the person's identity to the contacts, but we would try to limit or try to get the contacts to isolate and to limit the spread in that way. There is a Wes Duke, who is the general counsel for the cabinet, has been developing some guidelines specific to mental health providers, Emily, that I don't believe they're posted yet, but will soon be out.
Okay, great. I think we have a follow-up to that from Olivia. Olivia, if you want to unmute and just ask your follow-up. And if you can't unmute, then you're welcome to put it in the chat box for me.
Hey, Emily.
Hi.
Sorry, my dog is in the background. So I work for the Kentucky Coalition Against Domestic Violence, and one of our concerns with contact tracing is, we do want our shelters to be able to participate in this in the way that they need to. But at the same time, via VAWA confidentiality laws, we could not confirm or deny, in the case of someone being in a shelter, that they were even there. Right. Or that even received services at all. And so we were in particular just wanting some guidance from you all, and we're looking at it kind of from our other coalitions too, on just what this could look like, so that we can be giving you all what we need, but so that we can also be honoring those confidentiality laws that we're working with.
Right. Yeah, Olivia, we just last week we had an internal call again with Wes and with advocates for this was pretty much focused on domestic violence, and again the same kinds of things where we're going to protect the identity of the person that that test positive. But, we do have to balance, well, not to have to balance, but we do need to identify those contacts and try to make sure that they do the things they need to do to make sure that they don't allow for the spread of COVID. But every protection would be in place to maintain the confidentiality of the individual that tested positive in those circumstances. I think that there is going to be some guidance that's going to be distributed coming out of that meeting last week as well. I just don't think it's quite ready to go out. But in all cases, we're going to work with the community to make sure that we don't create some sort of unintended consequence in those kinds of circumstances. I think Emily, just a brief digression too. The other thing I didn't talk about was fraud. And this has been a real, it's a sad state of affairs when people try to profit off this kind of tragedy, but we've already seen it across the state. So some of the guidance that I referred to, the communications guidance, has information around the types of questions that will be asked by the contact tracers and the types of questions that will not be asked. So they'll never ask for social security numbers or bank account information or the like. And we're suggesting that if that does happen, to terminate the call and to call the Attorney General's fraud hotline. We'll also be using a specific number. It's 844 Kentucky Trace, or KY Trace. That will be the number that we will leave with people to call. And then hopefully we're working with the telephone carriers to try to make sure that that appears on the caller ID when the call comes in from a tracer. So we're taking some steps to try to minimize the likelihood of fraud.
Yeah, I think that could make a real difference. I know that's been an issue with other outgoing calls from state offices. There was a question from Cindy Burton that is about leaving messages on the phone. So if someone doesn't answer the phone, does the contact tracer leave a message?
Yeah, they will leave a message. The message will be pretty benign, that they just need to call the health department. And all of this will be focused through the local health departments. But to call the health department regarding the COVID, a matter related to the COVID. And then, the folks hopefully will call back in. There are, the software is set up with a calling application so that, the tracers are reminded to make calls on a daily basis. And, to the extent that we're not getting those calls answered, then we'll look for other ways to try to make contact with the contacts. If, it's in local areas, sometimes the health department folks know the local areas so well that they might actually know the person. So, there's a number of things like that, but they will leave messages, and it'll be the 844 KY Trace number that they'll leave for the.
Okay. Well, I think that's a really important thing for us to be communicating then, that's the number. Okay. One last question: is hiring for contact tracers and social support connectors still ongoing? And is that being handled at the local health department level?
Yeah, it is ongoing. We have, as of yesterday, we've added 315 people. There were 430 folks doing disease investigation and contact tracing in local health departments before COVID happened. And since then, we've hired 315 people. We have CARES funding that would allow for up to 700 to be hired. So, roughly another 400 people. We are a little ahead of the virus right now. So, the guidance we've given the local health departments is to be slightly overstaffed so that you have some capacity if you have an outbreak. I learned today, for example, in Graves County, they had 12 new cases related to a chicken plant there. And, they had folks that weren't completely busy yesterday, but they're busy today. So that's, we're not going to staff up to 700 in 2 weeks, but we will try to stay ahead of the virus. I think we all believe that we will be able to perform better than the rest of the country, but we're going to have our challenges as we move through the summer and into the fall.
Yeah, I think the governor a few weeks ago compared contact tracers to connectors. And I thought that was a really useful comparison because these are people that we know and trust in our communities.
Mhm.
The other, sort of reflection that I've had on contact tracing is that it is not new. People, it's really high profile at the moment, and typically it's done when people don't even realize it's happening.
Right.
But have you found a way to sort of connect this to what health departments have been doing for decades?
Yeah, we've been putting more and more emphasis on that, Emily. That was feedback from the field because I think as everything got started, was moving so fast. It's just when you're reacting to a crisis, some of the communications are going to be a little rough at first, and so that wasn't initially emphasized at the level it should be. But that's why now when I report staffing numbers, I always report that we had 430 people doing contact tracing across 61 health departments forever. And they were doing things like HIV, tuberculosis, the other respiratory diseases. And, it's something that health departments have done since there have been health departments. So it's not a new process. It's just, we've never dealt with a pandemic on this scale, or at least, folks that are still alive today haven't. And so, that's the real difference, just the volume. But otherwise, it's a time-honored, effective tool.
Yeah, absolutely. Well, thank you very much again for your time and for taking the time to answer these questions. I know you have to run. I will send you any follow-up questions, and then if you or Becca can send me materials that you'd like us to share with our network, but the people on the call today, but also more broadly, we'll be happy to do that. We definitely want this to be successful, and we want to help in any way we can.
We will absolutely do it, Emily, and thank you very much for allowing me to have this time with you guys.
Absolutely. Thanks again. And
right.
Angela, if you could, yes, thank you. Start sharing our screen. All right. Well, I hope that was helpful for everyone. If you still have unanswered questions and you'd like me to pass those along to Mark and his team, I'll be happy to do that. So just keep dropping those in the chat or send me an email. But we're going to move ahead now with the rest of our agenda. And Angela, if you could just move to the next slide. All right, great. So as usual, we have a pretty big agenda to cover today, and now we've got an hour to do it. So we're going to try to be a little more brief than we have been on past calls. Since this has become a monthly series, our plan for these briefings is to make sure that you get the latest information on the state and federal response to COVID-19, updates on our safety net programs, and opportunities to educate and advocate. We'll try not to repeat too much of what we've said in a previous month. We're really going to focus on what's changed in the past month and anything that we are anticipating for the future. So if you're already familiar with our ThriveKY campaign, you know that our core purpose is to meet the basic needs of every Kentuckian through systemic change. And you can see our shared principles on this slide. We'll be talking about some of the ways that the state and the federal response to COVID-19 is or isn't meeting the immediate needs of Kentuckians during this crisis. But our more pressing job is to fundamentally change the way that our safety net is viewed and funded after the state of emergency ends, so that we can truly come out of this crisis as a stronger Commonwealth for all Kentuckians. So a lot of the work that we do is really looking toward that better normal. It probably goes without saying that we don't want to return to the normal that we had before COVID-19. We need a more equitable normal. And in thinking about what that better normal looks like from a policy perspective, we need a path that can really lead us to true equity through anti-racist and anti-poverty policies. So we'll be sharing some of our thoughts on what those should look like in the next coronavirus relief package and beyond. And if we can click to the next slide, Angela. This is the rest of the agenda that we're going to be covering today, and we'll have ThriveKY partners presenting on each of these areas based on their expertise. And with that, I think Justin is up first, and he'll be giving us an overview of the economy.
Great. Yeah, and like Emily said, we had some really great and important updates early on, so I'm going to try and move really quickly. And if folks have questions or things that they'd like to discuss on follow-up, just throw those in the chat and we'll get to them. So let's go on to the next slide. So, folks have, I think, realized by now that COVID and sort of the resulting shutdowns and stay-at-home orders have really left us with a huge jobs deficit, one unlike we've ever seen before. If you look at this chart on the left, that initial dip represents what happened during the Great Recession, where jobs sort of slid down into a hole through 2010 and then have steadily climbed since then. What we've experienced lately is really a cliff where we saw the largest loss in jobs in the last 50 years in a single month. And although those jobs have started to rebound, that's going to be a long process that is going to take a lot more than just businesses reopening, because some businesses won't reopen. Jobs are changing fundamentally right now. And even if we were to sort of return on a normal pace, we lost nearly, well, over 300,000 jobs. We're now just under 300,000 jobs shy of where we were in February. So let's move to the next slide. And those jobs really span every industry and every part of the state. Urban areas saw the largest job losses in Kentucky just by nature of the types of jobs there in manufacturing, accommodations and food services, which are, hotels and restaurants, healthcare and social assistance, which includes childcare and retail. And although some of those jobs have begun to come back, it's really concerning that in our state and local government sectors, we're actually seeing accelerated job loss, especially as delayed reductions in revenues have led to a resulting layoff in various agencies and city and county governments. So, we are seeing some rehiring in most private sectors, but our public sector jobs are still suffering. And beyond that, unemployment is still at 11% in the state. So although we're seeing a little more activity, unemployment is still very high, and it's expected to remain high through 2021. I think nationally, CBO suggests that we're going to see a 9% unemployment rate at the beginning of next year. So let's move to the next slide. And, I think it's also important that we point out that, we're seeing sort of broad-based economic hardship, but that is not even throughout all Kentucky. We know that people of different races, especially Black Kentuckians, have long faced historical and structural barriers to good employment, good education, wealth building, and several other things. And the legacy of that continues now in Kentucky. So let's move on to the next slide. Most notably, since this whole thing started, we know that unemployment for Black Kentuckians has been higher than that for white Kentuckians. So if this bar chart compares unemployment insurance claims by race, and although Black Kentuckians make up 9.8% of the covered workforce, so folks whose employers pay into unemployment, they make up 12.4% of the layoffs, unlike white Kentuckians who make up almost 87% of covered employment, but only 85% of those who were laid off from their jobs. And that is just one example of what we know more broadly. According to BLS data, Black Kentuckians have a higher labor force participation rate than any other race or ethnicity, but they also have higher unemployment, lower wages. They have less paid time off offered by their employers. And we also know that they've had more exposure to COVID-19 because Black Kentuckians tend to work in frontline sectors that have more, exposure to the disease. So let's move to the next slide. Using a slightly dated but still relevant set of data from the state, Black Kentuckians are the only racial breakdown that experience higher rates of cases, so higher infection rates and higher death rates. It's true that most sort of non-white folks here in the state have either higher infection rates or death rates, but Black Kentuckians really bear the brunt of this disease right now. And I think for many reasons, this reason included, that's why it's so important that we focus on making sure every Black Kentuckian has coverage. So let's move to the next slide. So folks will remember that Governor Beshear made a commitment to get to 100% coverage for all Black Kentuckians. Since that time, we know that the state has broadened that to really make sure every eligible Black Kentuckian and Hispanic Kentuckian is covered. And if you look at this chart, this really focuses on Black Kentuckians. I put this together back when that was the sole focus. You know, the urban areas, especially around Louisville, in particular West Louisville, Lexington, and parts of near Christian and Logan counties, this is where the majority of these folks live. And so it makes sense that the state will now turn around and start doing some advertising campaigns and focusing on folks that are already eligible for Medicaid. We'll talk a little bit more about that in just a minute. But we also know that Black Kentuckians work in sectors that, like I said, have higher exposure rates, like restaurants and accommodations. And so I think focusing on folks who work in those industries would also be a helpful way of ensuring that folks are covered. And, you know, we have really good coverage options already for a lot of folks. In fact, the ACA, which brought on Medicaid expansion and the marketplace, did a whole lot to close the coverage gap between white Kentuckians and Kentuckians of other races and ethnicities. But still 21,000 Black Kentuckians don't have coverage, which is roughly 6.4%, or 1 percentage point higher than the average. Half of these folks are working age. Again, that is helpful in knowing where we should target, because that gives us an opportunity to reach out to particular industries. And most of them qualify for some form of public subsidy. So 88,000 of the 21,000 are likely eligible for Medicaid, and 10,300 are likely eligible for some marketplace subsidy. You know, I used to run cross country in high school, and we would always, you know, keep in mind that we were only as fast as our slowest runner. And so in order for us to be successful as a team, we all needed to do well. And so this is no exception. And so I really strongly believe that by focusing right now on the folks with the highest uninsured rates, that's actually going to ultimately get us to the real goal, or the ultimate goal, of achieving 100% coverage for all Kentuckians. We know, again, from our experience with the ACA, that folks who were always eligible for coverage under Medicaid suddenly became covered because there was so much attention paid to this, and people went online to try and find out if they were eligible for this new coverage, and it ends up that they were eligible all along. So I think by bringing a new emphasis and creating new outreach opportunities, and maybe even expanding coverage opportunities for Black Kentuckians, ultimately what we're going to see is everyone is better off. So let's move to the next slide. And, you know, I also just want to point out that coverage is just one part of what it takes to have good health. And really, I think as a coalition, we strive for good overall well-being. And so if we're really going to focus on an anti-racist approach to health equity, that means that we're going to have to improve the opportunities to have good health to begin with, which really means dismantling systems and institutions that are legacies of a racist system that need to be addressed in order to ensure that folks have economic stability, that their neighborhoods, their physical environments are safe and walkable, that there are reduced violence in their communities, whether that's police violence or otherwise. People have opportunity for good education, that there's access to food, and particularly healthy food, that their community and social contexts really feed into well-being, And then finally, that they have a healthcare system that enables them to be healthy. That does mean coverage, but it also means other things like access to clinics, routine preventative care, and then of course healthcare quality. So we're going to go ahead and stop there and transition into food assistance, which I believe Jessica is going to cover for us.
Hi, yes, this is Jessica Klein with the Kentucky Center for Economic Policy. Just a few updates around food assistance for you. We can go ahead to the next slide. Even before the pandemic, around 1 in 7 Kentuckians were food insecure. As of May, that's over 600,000 SNAP participants in Kentucky. So that means we've seen an additional over 110,000 Kentuckians using SNAP since the beginning of the pandemic. So these increases are largest in Louisville, but also in some rural counties like McGoffin and Lee. So as the pandemic continues, we'll definitely see more lost jobs and wages, which means people needing more benefits like these to put food on the table. Next slide. So a few things that we've been doing to address this growing need is emergency SNAP, which provides extra benefits to households to reach their maximum allotment for the household size. So we've been doing that since April, and we've just been approved for July. That's over 157,000 households who've been participating in that, and it goes automatically onto their EBT cards each month. We've also had 6-month recertifications, which basically means recertifications that were due in May would now be due in November, but those are about to start back up, so recertification processes will begin soon. We've also seen a lot of flexibilities in the administration of the program, things like being able to purchase online using your SNAP card, waiving work reporting requirements, so you don't have to report those hours you worked, and extended call times in their call centers and that kind of thing. So even with all of this, the need is still continuing to rise. Even the emergency SNAP benefits I mentioned leave out 40% of the households with lowest incomes. So what we would like to see is Congress increase the minimum benefit that you can receive from $16 a month to $30 a month, and an increase of maximum benefits by 15%. So this would really ensure that everyone sees an increase during this economic downturn. Next slide. Another great program that's been implemented is the Pandemic EBT, P-EBT. And what this does is provides benefits for children eligible for free and reduced school meals while schools were closed. So it's kind of a one-time payment of that $313.50. So some people would have seen this automatically deposited on their EBT card if they have SNAP. If they don't, they may have received a card in the mail. So if you haven't received that card, then you can apply online. And the deadline has been extended until August 31st. So there's an email, a phone number, and a website where you can find that application. Next slide. So these are kind of the other nutrition programs we have in the state. Women, Infants, and Children provides benefits to new mothers and children under 6. Local health departments implement that program and can provide more information. They've also implemented several flexibilities within the program to help make it easier for people to access that. For senior nutrition programs, you can contact area agencies on aging and independent living. They have things like congregate meals and Meals on Wheels. So congregate meals are now pick up and delivered, but it kind of depends on the region. So you'd have to call to get more information on that. For Meals for Children, for free meals, we have over 500,000 kids that utilize this. And you can text this number, text food to 877-877 to find out a location near you. And even if you do have SNAP or P-EBT, you can still receive those free meals and you don't have to bring your child to pick them up. So again, more flexibility is extended there throughout August. So those are available. And then food banks are also available, and you can find those locations at feedingky.org. I think that's it.
Okay, great. We can go to the next slide, Angela. I'm going to share a few updates with you about primarily Medicaid and Connect. So something that I shared during, I think, last month's presentation is that Kentucky's uninsured rate has more than doubled since March. Before the pandemic came to Kentucky, we had about 223,000 Kentuckians who were uninsured. That's already a big number, something that we need to work on, but that's more than doubled. And most people have lost employer-sponsored health insurance with their jobs. So a big part of the, that loss, the vast majority are people who lost a job, lost employer-sponsored health insurance. And the Urban Institute is estimating that this ranges anywhere from 233,000 to 438,000 Kentuckians. And this is really tied to unemployment. So as we see more Kentuckians losing jobs, losing ESI, the really important thing to note here is that most of them are eligible for Medicaid or a subsidized marketplace plan while they are unemployed and uninsured. And these are really important programs that most people are eligible for, but they may not know it. And our job as advocates is to make sure people know what their options are, educate them about, how they can apply, and really encourage that through our messaging. So we can go to the next slide. I think what's most important for people to know right now is that because of the current state of emergency that we have, it's a public health emergency that was put in place by HHS, the federal government, we can actually cover more people through presumptive eligibility Medicaid, which we call temporary Medicaid because that's essentially what it is. And the term presumptive eligibility isn't one that most people understand. But temporary Medicaid covers people for up to 90 days. And just, I think last week, the Secretary of the Cabinet for Health and Family Services announced that people could get 2 periods of presumptive eligibility within a calendar year. That means if you add those 2 90-day periods together, it could be up to 6 months of coverage. And this is currently coverage that anyone who is under the age of 65 and uninsured in Kentucky can be covered through presumptive eligibility Medicaid regardless of income. That's not the way it typically works, but because of the current public health emergency, they have waived the income guidelines. And that's information that a lot of people don't know. So you can see this graphic. We've been sharing this on social media. It includes information for both regular Medicaid and presumptive eligibility. Now, regular Medicaid is always available to people who are at or below 138% of the federal poverty line. And you can see household size and adjusted gross income there to give you a sense of who would fit into those income guidelines. This is 12 months of coverage. And so if someone is eligible for this, it would be better for them to apply for regular Medicaid than for temporary presumptive eligibility. The trade-off is that it can take longer to apply for regular Medicaid, but another option is you can apply for temporary coverage, and once you get that, which is almost immediate, it can be the same day, then you can start your application for regular Medicaid. When you're covered by regular Medicaid, you are typically enrolled with an MCO, a managed care organization. So those are currently Anthem, Aetna, Humana Care Source, or I think there's just Humana now, WellCare and Passport. If you are enrolled through presumptive eligibility, it's called fee-for-service, but that just means the state is paying directly. And the providers differ a little bit between those two. So that's another benefit of taking the time to apply for regular Medicaid. But the bottom line is we want everyone to apply for coverage who is eligible. And if you're uninsured and under the age of 65, you're eligible. So we want to make sure we get those people covered. Just one other thing to mention with regular Medicaid, not everyone has a Benefind account or has the ability to access it. You can get locked out pretty easily. It can be complicated to use for some folks. So if that's been a problem and you're trying to apply and get your documentation in, you can send it to that email address. Let's move to the next slide, Angela. Just a few other things that people should be aware of during this public health emergency. I mentioned that this was put in place by HHS, which is Health and Human Services, part of the federal government. That state of emergency was originally set to expire on July 25th. That was just extended last week to October 25th, roughly, extended by 90 days. So if you do the math, it might be a little different, but I would say roughly October 25th. And during the public health emergency, the things that are outlined here remain true. As I said, Medicaid income eligibility has been expanded for temporary coverage. There was actually just last week announced a 3-month extension of coverage for anybody who's been enrolled in temporary presumptive eligibility. If their end date was originally June 30th, that's been extended by 3 months. There are no disenrollments. States are not allowed to disenroll people from regular Medicaid unless they are requesting to be removed or they move out of state. Right now, the state is not sending out letters that are asking for information to verify income or address or a number of other things that typically lead to people being disenrolled. It leads to a lot of churn. That's not happening right now. There are no co-pays for any services, and we hope that that remains true ongoing, but at least during the state of emergency, there will be no co-pays in the Medicaid program. And up until, well, it might still be true today that there are no prior authorizations being required right now in Medicaid, but soon prior authorizations are being put back in place with the exception of behavioral health and substance use disorder services. So there will continue to be no prior authorizations for behavioral health or substance use disorder services in the Medicaid program, which is excellent news. And then there are more options for telehealth, more options for getting longer prescriptions written, and then also for getting those delivered. We can go to the next slide, Angela. I also shared this information on our last call, but I think everyone has heard by now that MCO contracts were announced. I think it was sometime early last month. The contracts, while they're in place now, no changes will be seen in terms of which MCOs are operating and covering patients right now, or Medicaid members, until January 1st of 2021. The 2 MCOs that did not receive contracts, which would be Passport and Anthem, those MCOs have protested. And so we are in a protest period. There is a small chance that something will change, but assuming that nothing does change, the 5 MCOs that were awarded that you see there on the screen, Aetna, Humana, Molina, United, and WellCare, they will start providing services January 1st, 2021 under these new contracts. Aetna has the SKY contract. This is a new program, and it is specifically designed for children in foster care and for children that are involved with the Department for Juvenile Justice. And so we're learning more about that, and we'll share more details when we have them. And then there are incentives in these contracts that are meant to really focus on social determinants of health, which is really critical to not just the health, but the well-being of Kentuckians. And then something that you should know is every MCO enrollee, anyone who currently has Medicaid and is covered by an MCO, they will have the choice to change their MCO for the year 2021. There's an open enrollment period that will start in October, and everyone will have that choice. But Anthem and Passport members, I think, will probably get a little bit more time to choose, or they'll get more notice about their options. So we can go to the next slide. And then this is the last slide that I have for you today. We just got the announcement a week or 2 ago that the governor wants to bring back Connect. Connect is a state-based marketplace, and I think most of us are familiar with that. When we had Connect in Kentucky, when we were using that as our integrated system for enrollment through Medicaid or qualified health plan that had subsidies, it was really, really effective. It was very popular. People found it to be easy to use. We had great customer service. We could control the length of our open enrollment periods, and whenever there were system issues, we had people in Kentucky who were able to resolve those quickly. So I have listed out here the top 4 benefits, and I cheated a little bit with some subpoints, but definitely Connect has lower fees than healthcare.gov. There's a lot of misperception about the cost of running Connect versus using healthcare.gov, but the truth of the matter is that Connect has lower fees. It's half the cost. And the state has more choice, more control. in what options are available on Connect. And so we can design different types of plans that wouldn't be able to be sold on healthcare.gov. We can have more competition, and in those ways we can actually decrease premium payments as well as these fees. I've already talked about the better customer service, but the integrated piece of this is really, really critical. Right now, we have 3 places where people are going, for their coverage. We have the temporary Medicaid application, that presumptive eligibility, that has its own link, its own application. We have the Benefind, which is for regular Medicaid. And then we have the Kentucky Health Benefit Exchange, which takes you to healthcare.gov. It's very difficult for people to navigate those different options. And then if you're moving from one to the other because your income changes or your household size changes, then you're going back and forth between completely different applications. And when we have one integrated application, you put in your information and then you are directed into which application you're going to apply for. Is seamless. When your income changes, you can seamlessly move to a qualified health plan or back to Medicaid. And it's just a much better way to keep people covered and to reduce churn. So there's also a lot less stigma when people know that they can go to one place. It's not about their income. We're not sending people who are low income to one application and other folks to another application. I think that's better for all of us. So I'm going to wrap it up there. If folks have any questions about that, feel free to drop them in the chat, and we can move on back to Dustin. Thanks.
Great. Well, I have a very short update on unemployment insurance today, so we'll just jump right into it if you want to go to the next slide. So I think folks have seen this or some version of this slide before. Again, kind of like that jobs chart on the left-hand side there, that little bump, that relatively little bump is the Great Recession. These were our initial claims, first-time filers for unemployment insurance. And then, our normal week-to-week rate is between 2,000 and 3,000. And so, throughout this time, the state really didn't pay much attention to its unemployment insurance system. They didn't update its system, still running off of a 70s era based programming language, a 20-year-old actual program that they created back in around the 2000. And they had also closed in-person gatherings and laid off staff. And that's when we hit March, which is this wall here on the right-hand side. That's not an access label or anything. Those are initial claims that hit very quickly. The worst point of the Great Recession was around 25,000 claims. We had, I think, 3 or 4 weeks that were over 100,000 claims. Right now, we are at 30,000 initial unemployment insurance claims, which don't include initial pandemic unemployment assistance claims. I'll talk about the difference of that in just a little bit. We have almost 160,000 people taking out multiple benefits right now, multiple weeks of benefits, excuse me. They only get one benefit per week. And then we have roughly 40,000 folks who are taking out pandemic unemployment assistance, which is like UI, but it's specifically for folks who are contract workers, freelancers, gig economy workers, and then other folks who may be traditional employees, but their childcare is closed, they have COVID, or they're caring for someone with COVID, and other reasons like that. So I think it's important to look at this chart and to understand sort of the magnitude of what our state has been facing. But I also want to point to this chart as a reason to point to why we need extended and enhanced unemployment insurance benefits. So, if there's this many people who are not working right now, we need to make sure that they have money to pay their bills, because we want to make sure that they can keep their lights on, they can feed their families, they can continue to just sort of go through life while we continue to encourage people to stay at home, to work from home when possible, and if not possible, be safe at work if that they can do that. For those who can't, though, we want to make sure that, again, they've got that money they can spend, which is not only good for their families, but it's also good for the economy. Since the beginning of the extra $600 a week benefit known as pandemic unemployment compensation, Kentucky has received $1.6 billion, which is a large amount of money. And economists will tell you that for every dollar you spend in UI, it generates $2 in the broader economy. So that's roughly $3 billion, or right around 1.5% of our state's annual GDP in just a matter of a few months. That is incredibly important to not only to continue to keep the economy moving, but also to make sure that the folks who are making and selling the things that people are buying can also keep their jobs. In fact, one estimate showed that if we were to continue pandemic unemployment compensation, that's $600 a week, from this July, when it's set to expire, through next July, that would support 50,000 jobs, and I believe it's like $5.6 billion in our economy here in Kentucky. If you think about that inversely, that means that if we let it go, we could lose as many as 50,000 jobs, which is roughly half of the number of jobs we lost during the Great Recession. So simply by letting PUC expire, we could end up with a near recession level of job losses. And obviously that would be tremendously disruptive, especially while we're trying to just sort of make it through this pandemic until we can get a vaccine and suddenly, actually return to a sense of normalcy. So let's move on to the next slide. I say all that just to set up for this slide, which is to say that the CARES Act, which brought pandemic unemployment compensation, the extra $600 a week, into existence, allows that to expire July 25th, which, if you're keeping count, is very soon. It is not clear yet whether or not Congress is going to re-up it, but I hope that folks on the call would encourage their senator, because the House has already passed an extension of it, to at least pick up this portion, if not, many other aspects of sort of institutional and individual aid that's required. There's some other terminology here. I'm not going to go through it. I'm just going to leave that there, and I'm sure if you would like the slides, we can get them to you. But just to say that in the HEROES Act, which is the extension passed in the House, pandemic unemployment assistance, which is that sort of coverage for non-traditional adults who are workers, that it gets extended through July 31st, which is only a month-long extension for initial claims, but people can continue to take out existing claims through March 31st under that act. Pandemic unemployment compensation gets a 6-month extension, which again is really important and is probably also too short, considering CBO is expecting a 9% unemployment rate at the beginning of next year. So I'll stop there, and I'll go ahead and hand it off to Tyler, who's going to talk a little bit about what rights folks have around unemployment insurance and how they can continue to get help while jobs are scarce and they need to stay at home.
Thanks, Dustin. Yeah, so there is an extraordinary amount of confusion about unemployment right now. Not only the logistics, how do I, get unemployment? How do I get someone on the phone? How do I apply online? But there's also a lot of confusion about what people's rights are. As Dustin laid out, there's been a number of new programs. Many of them have different rules. They're on different timelines. So I just wanted to do a short but important sort of reflection on what workers' rights are when it comes to unemployment insurance. Go to the next slide. So I guess the most important way to think about UI is there's the traditional UI system, which had its own rules, well, still has its own rules. And the programs that Dustin talked about effectively created, parallel and or supplementary programs to either piggyback or work with the state UI system. So traditionally, you could only get UI if you got what was, good cause for separation. So that was basically you were laid off for no fault of your own. Now, with the creation of PUA, Pandemic Unemployment Assistance, it effectively created a second, this is an oversimplification, but a second UI system to vet workers through. So the way that it works is when you apply for UI, the state basically looks, do you qualify for traditional state UI? If not, you are then that, worker is supposed to then look, okay, do you qualify for pandemic unemployment assistance? You have to qualify for at least $1 in traditional or PUA in order to get the $600 that Dustin was referencing. I say all that to say that things are in a state of fluidity right now. There's a lot of jobs that have been reopening, but numbers are on the rise, infections are on the rise. It's unclear if we'll have a rollback, if we'll keep moving forward. So, we could have another one of these conversations a week from now and things might change. Just as far as the virus, there's also, will the federal government act to pass any new federal aid, COVID aid packages? So it's important for folks to know that if they don't qualify for traditional UI, they might still qualify for PUA. Here are a number of questions, basically, or situations that folks might fall into that would allow them to qualify for PUA. Now, Dustin's point about the importance of the pandemic unemployment check, the $600, in addition to either traditional or this PUA unemployment. And I'm sorry I'm throwing so many acronyms around. But let's say traditional UI, you might get between $200 or $300 per week. With PUA, you normally get a little bit less, so say about half of that. So if you're going from making, let's say, $250 in UI with $600, that's $850, down to just $250, that's a huge cut in income. So this coalition is definitely urging federal action to extend those benefits as much as possible. And I'll just say that there is there's a lack of clarity about how some of these might fall, right? Like, what actually constitutes lack of childcare? What sort of diagnoses do you need outside of a COVID designation? What kind of pre-existing conditions count to allow you to get PUA? So I won't belabor it, but I'll just say, make sure you, when applying for UI, answer these questions appropriately. Make sure you do get PUA if you need it. And just know that if you feel like you've been denied unemployment insurance, even though you did meet one of these criteria, make sure to contact the Labor Cabinet and or your local legal aid office to get help to make sure you get the benefits you need. That's all I got.
Hi, everyone. This is Adrienne Bush with the Homeless and Housing Coalition. We'll move on to the next screen. Okay, so right now, there is still technically a statewide eviction moratorium in place for non-payment of rent reasons. However, if renters are charged with other lease violations, theoretically they could be they could have an eviction filed against them in court that could take place beginning in June. And there is a lot of conflicting information about whether or not local circuit court clerks will accept filings around non-payment of rent, with some judges saying yes, others saying no. So the bottom line is, if you or any of your clients get a notice, get in contact with your local legal aid office ASAP. Next slide. Okay, the other thing to know here is about utility protections. Under executive order by Governor Beshear, no one should be cut off from their utilities for non-payment. That applies to all utilities. And then it's similar to rent utility charges can still accrue. But there are programs to help, particularly with utilities. LIHEAP, which many of you are familiar with through the community action agencies, is now year-round. And then there are also special summer rounds of help for cooling costs. So for renters, the national COVID-19 policies, many of you may remember that any rental property with a federally backed mortgage service is prohibited from evicting, but that only applies to 1 in 4 properties nationwide. There is a searchable database that is hosted by the National Low Income Housing Coalition. And similar to the state eviction moratorium, it still does not relieve the tenant of being responsible for the rent. Next slide. Okay, so this is the chart of CARES Act money, phase 1, that is coming to Kentucky. And I provided it last month. I just want you all to know that it is not here yet. This money has been allocated. It is being held up by HUD, essentially. And there is actually a second wave of emergency solutions grant money coming. But again, the first phase hasn't arrived. So I did not include it in this chart. But in the meantime, people are struggling. We need this money now. And the longer we have people experiencing literal homelessness, not only is that a public health risk, we also, without significant rental assistance, we're going to see a coming wave of evictions, not only here in Kentucky, but nationwide. So the next few speakers are going to talk about the HEROES Act and other provisions that are necessary to for Congress to pass, and one of those is rent assistance. So with that, I'll turn it over to the next speaker.
Hi, I'm Kara Stewart with Medicaid Voices for Health. And let's turn our attention to what's going on in Washington, D.C., which is nothing the same as last month, because we're in the same situation as we were last month, where we have had the HEROES Act passed. You can go to the next slide. Which would be very helpful for exactly what Adrian just mentioned, because it includes housing assistance, it includes rent assistance, mortgage assistance for landlords and otherwise, and lots of money that is necessary for us to begin to kind of stabilize out of our economic process. But nothing has happened. It passed the House, and now we are still, just like last month, waiting on our Senator, Mitch McConnell, the Senate Majority Leader, to call it to the Senate floor. There is no anticipation that he's going to do that anytime soon. And our sources in DC tell us that there haven't even been conversations about a compromise bill. So time to put the pressure on. There's lots of details here about what's included, most of which we went over last month. I added that it does also boost essential worker pay. They call it hero pay, which is disproportionately affects women and people of color. And then it requires us to provide free soap, hand sanitizer, and other hygiene products to people in detention, which they currently are aggressively refusing to do, which is cruel. It also protects some voting rights and also protects our postal service so that people, especially in rural areas, will be able to be, get mail and send things and be connected. So you go to the next slide. So what to do? We have got to take some actions. We've got to get motivated to put some pressure on, because right now this is just laying around dead in the water. And I know that there's a lot of energy and attention as to what we are doing to dismantle our, white supremacy culture that's happening right now. And this is also an anti-racist action. So I wanted to include just to point out that there are ways in the HEROES Act that are specifically anti-racist and that will reduce disparities. So some of the ways to reduce disparities is that we have a disproportionate number of people of color with Lifeline, and this ups and increases to unlimited minutes and data. And also we, of course, I'm sure you all know, have a wildly disproportionate number of, especially Black men, but people of color incarcerated. And this requires prison communications to be just and reasonable, and it sets a cap, which is a very just thing to do, because if you're not aware, there is horrible price gouging happening to those who are incarcerated in their ability to communicate with their families and maintain the connections that are necessary to be successful and live in community. So I hope that everyone watching, when you get this, you can click on that link, and we've got some of these points written out for you in an action letter that you can send your own to Mitch McConnell. But let's stir it up. Let's stir it up and make some demands that we not continue to fall through this hole, and that we fund our local governments and we get some money from the federal government to help us get through this. Go to the next slide. And if you want to call right now, I will not be offended if you disconnect from me and pick up the phone. And there are some phone numbers to get started. I dial the DC one first, and then I start rolling through. And I have no shame, and we'll call all of them. And I just want to throw that out there, that is an option to you too. And when you get this, that link will be live, and you can send the letter. So call Mitch McConnell, please. Everyone on this call, to the best of my knowledge, is a Kentuckian. So therefore, it is my opinion that he is required to listen to us, since he is elected to represent us. If you're still here, which I hope you aren't, and you're on the phone, call Mitch McConnell, you can go ahead, Angela. We're going to move back to Angela. Sorry if I kicked anybody off. Angela's got important stuff to say.
If you missed this portion in order to call Mitch McConnell, I suppose that's okay. Okay, I want to make sure that everyone on this call is registered to vote. If you go to www.govoteky.com, you can check on your registration. You can get the latest on how we're going to be voting in November. We still don't know what that's going to look like. We had some pretty good success with absentee voting and mail-in voting in the primaries, so that is encouraging, but we don't know what November is going to look like. So it's very important to make sure that you're registered, make sure that your neighbor's registered, make sure that everyone in your Facebook feed is registered, make sure that all of your Twitter followers are registered. I used to use a great graphic of this kid who was signing folks up who were waiting in line for a chicken sandwich, but I don't use it anymore because it doesn't exhibit proper social distancing. 2020 is a very important election year. The general is on November 3rd. Again, method not known, but you can get active in your local races, support candidates, spread the word to increase turnout, and remember that elections have consequences. And while you're registering to vote, also make sure that you are counted in the 2020 census. Kentucky's response rate so far is 65.3%, which is a little bit higher than the national average, so that's good, but it's still not enough. We stand to lose 2,021 federal dollars per uncounted individual in Kentucky. It's imperative that you fill out your census. Again, make sure everybody in your Facebook feed is filling out your census. I've been obnoxious about it, but if I talk to anybody about whether they filled out their census, the answer is inevitably yes, because they don't want to hear me talk about it anymore. It helps ensure fair representation and that we have good representation in Congress, and it is not too late to complete. And lastly, I'm going to send it back to Emily for resources for advocates and consumers.
Great, thanks, Angela. So what we have here essentially is all the ingredients that we need for a really robust economic recovery and equity, health equity, racial equity for everyone. If we can get our policymakers to do all of these things, and if we make sure that people are voting, filling out the census, wearing their masks, participating in contact tracing. So this is the work that we do as advocates. And I'm not going to go through all of the resources. This is something that we've sort of been trying to add to as we do these monthly updates, but you will get the slides and you can click on these links. And of course, if you ever have questions, we'll make sure to get you answers. One resource that we don't have on here, but we're going to put a link to in the email that we send you, is specifically related to the stimulus payments. There are still a lot of Kentuckians who maybe don't file their taxes for one reason or another, and they have not gotten their stimulus payment. And we need to make sure that every Kentuckian who is eligible for a stimulus payment gets it. And then, of course, part of the HEROES Act or whatever the next package is in Congress, we need to make sure that there's another stimulus payment, especially for people who may not have gotten it the first time, which includes a lot of immigrants and people who are lower income. So one thing I do want to touch on specifically is our story banking project. We are looking for people who can share their stories about what helps them to stay healthy, whether that's having coverage, having food assistance, having help with successful reentry from incarceration and getting back into the community, having affordable housing. There's so many ways that people can get healthy and improve their health, and we know that these social determinants are all part of that. So we want to be telling these stories about our safety net and making sure that our policymakers and of course the public understand the value of the safety net, why we need to strengthen it, why it's good for all Kentuckians, but particularly we need a safety net that's there for our most vulnerable, and there for people whenever things like COVID-19 happen that we could never have anticipated and can't control. So please reach out to me, or you can contact Ryan Morris directly if you want to be involved in that work. We're looking for people who have directly been impacted or benefited from the safety net, but also for people who are on the ground working with them. So we work with community health workers, with application assisters, with providers, people in the community, at food banks, you name it, shelters, who see the value of the safety net and want to share that story. So with that, I'm just going to share the dates for our next monthly advocacy update, and then we have an Advocacy 101 training coming up. So Advocacy 101 is a training that Dr. Sheila Schuster, who is the board chair for Kentucky Voices for Health and also the director of Advocacy Action Network. Most of you probably know who she is. We call her the godmother of advocacy in Kentucky. She will impart all of her wisdom during this training, which is 90 minutes, and you will be a better advocate for having taken it. So please register. We'll have a link in the email update. We're also putting all of this out on social media all the time. So if you don't already follow KVH or the partners that we have on this call, then you should follow us. You should find us. I think on the next slide, maybe the next slide. There you go. You have our social media handles, our email addresses, our web pages. So just be sure to connect with us in any way that you can. And I see some things have been going into the chat. I think, yeah, we are definitely sending out all of the materials that we covered today. The recording will be going out in email. You'll probably all be receiving this tomorrow. And then if there's anything else that you need, you know how to reach us. So if there are any questions that folks have, I think we have 2 minutes. I think this may be the first time that we have finished our call on time with 2 minutes to spare, so go us. If you have any questions, drop those into the chat and we'll answer what we can, and otherwise we can send answers by email. Angela, have you seen any? I haven't been able to keep up with what's been coming in.
We just had one asking if CEUs were approved for this meeting.
So this session, we don't have CEUs. I actually think that we do have CEUs approved for social workers. I will check on the status of that. We are applying for CEUs for community health workers for the advocacy updates, and we should have those available for the August session. If you have some other license that, not social work, not CHW, then we can provide you with like the objectives, and of course you can use this presentation to show that you did the webinar, and that may be something that you can use to apply for CEUs. But we will continue working on this. I see nursing CEUs as a request, and that's something that we've found cost prohibitive, but we can continue to explore it. If there's any way that we can provide you with the information that you can apply for those yourself, though, we're happy to do it. All right, well, thanks everyone. We'll look forward to seeing you on July 14th for Sheila's Advocacy 101 training, and then again in August for our next monthly update.